Hi, I'm Jeanie, and I'm here at Dr. Bob's office. I've been a patient of his for about 6 years now. I came in a few years ago for a treatment and was very pleased with the results. And he has something new now. It's a radio frequency and laser treatment. So I'm hoping to get my chin and my cheeks up away from where they dropped and look and feel a little better about myself. And so I'm looking forward to that. The staff was excellent. I called in to get some information and they followed up and they were very caring and very comfortable office to come to. So I'm really pleased to be here and hope that the results will be as well.
Hi, I'm Dr. Bob Bharatwal, Medical Director of Vitale Medical Aesthetics and Dr. Bharatwal Aesthetics. We're here today with Jeanie, one of our patients. How are you today, Jeanie?
Good, thank you.
Wonderful. Jeanie has actually been a patient of mine for several years now, about 6 years, I believe.
About 6 years.
And she's come for other procedures in the past, but today she's here for a new procedure.
Yes.
Something new and exciting that we talked
Yes.
about today. Jeanie is concerned about her as we get older. Naturally, our skin begins to sag, and so Jeanie's here to see what we can do about the skin underneath her neck and under her jaw line. So we're trying to firm her skin up and tighten the neck. And how we're going to do that today is we're using the latest technology from Syneron, which is called the Sublime Treatment. And the Sublime Treatment basically consists of a new technology that combines both bipolar radio frequency and infrared light. So how is that new? Well, in the past, a lot of machines that did skin tightening, similar to what we're looking at today, used one technology or the other. The wonderful thing about Syneron's Sublime Treatment is that it combines both technologies, both bipolar radio frequency plus the infrared light to give you a deeper effect. And how it works is that it stimulates the deeper layers of the dermis to stimulate activation and formation of new collagen. And what does that mean? New collagen helps tighten the skin, reduce fine lines and wrinkles, helps contour the face and lift, and restores the youth to the patient. A lot of patients who are looking for an alternative to surgery, I believe this is a wonderful treatment for them. Please note that this is not a replacement for plastic surgery or for a facelift, but it's for people who want a more conservative approach and to get that facial contouring and tightening of their skin. There are other treatments out there in the past that are currently used for skin tightening. One of them is called Thermage, which uses bipolar radio frequency as their primary method of tightening the skin. Another treatment is called a Titan laser, which uses intense photo light. So the great thing about the Syneron machine, the Sublime Treatment, is that it combines both technologies. And that's why you're getting a better, deeper effect in that formation of the collagen and a deeper dermal layer. So normally with patients, we do provide a free of charge for their comfort. We do apply a topical numbing cream. But Jeanie is pretty tough, but pretty high pain tolerance. And it's usually a very mild discomfort, if any discomfort at all. So before we get started, any questions?
I don't think so. I'm just anxious to get started.
Wonderful. Well, let's get started then.
Okay.
So this is our elōs Plus Syneron laser and radio frequency machine. So we're starting with the Sublime Treatment today for Jeanie. We're going to adjust the radio frequency, and we start at a more conservative approach, and then we gradually increase depending on the patient's tolerance. So we're all ready. We've already applied the gel, conductive gel. Now the wonderful thing about the Sublime laser is that it does have a built-in cooling head. Jeanie, if you can just feel that, you feel that coldness there?
Cold, yeah.
Great.
It feels good, actually.
And that's one of the wonderful things about this machine is that at the same time when it is stimulating the collagen deep within the dermal layer, it's also cooling the skin superficially, and that actually helps the radio frequency treatment penetrate into the dermal layer. So the patient receives little to no irritation or discomfort with that cooling effect. So it's a nice added bonus for the patient. So let's go ahead and get started. So we're going to go ahead now and start with Jeanie's neck. So Jeanie, I'm just going to, if you bring your chin up for me, perfect. And I'm just going to say 1, 2, 3, 1, 2, 3. How did that feel?
Barely felt it.
Pretty good?
Yeah.
Okay. And so we wait to look for any erythema. We watch the skin to make sure that there's no excessive irritation. And if there is, we wait to see if it calms down. The skin looks pretty good. We'll wait about 30 seconds to a minute. And so we'll continue. 1, 2, 3. 1, 2, 3. And as we step down, we go through small sections of her skin. How are you feeling, Jeanie?
Just fine.
Good.
Yeah.
Is it uncomfortable?
No, not at all.
Good. So as I walk down the skin, just feeling the cooling effect of the head and then stimulating the collagen. And we're just breaking the area down to small sections, overlapping. And so that's one pass so far. Normally we do at least 2 passes, depending on the patient's tolerance and the desired effect. So we're going to just take a look and see. And we see very little erythema, so we're going to actually do a second pass at a higher RF level, or higher radio frequency energy level. So you can see we're at a higher strength right now. Very little to no erythema in her neck. And she is getting both the radio frequency and infrared light, pulse light. How are we doing? Great.
You could actually fall asleep.
See, that's so not uncomfortable at all.
Not at all.
We've done just the second pass. How does it feel?
Great.
Okay. So now we're going to go to the other side and repeat the same procedure. So if I can get you, Jeanie, just to turn your head slightly and chin up for me, please. There you go. Try to get the biggest area possible so we can help firm and tone that skin. So we can just see a slight bit of erythema there, not that uncomfortable for the patient, and that is normal. So we know that the collagen is being stimulated. And so we're going to go over the same area again in a second pass. Okay, and how does that feel?
Fine.
Excellent.
Again, there's no discomfort.
Wonderful. So now we're going to continue, if you can bring your head right back. We're going to now look at the nasolabial folds and the jowls, a problematic area for many women and men. And we're going to target that area, several passes, again, at least 2 passes on each side. So here we go. We're just starting with the jowls. And we walk up in a stepwise progression, up the nasolabial fold. Okay. So you can see there's very little irritation of the skin. And we're still getting the effect we need for her treatment. And now we've completed the Sublime Treatment, skin tightening for Jeanie. How do you feel, Jeanie?
I feel great. I almost fell asleep.
So pretty calming.
Very calming.
And there's very little to no downtime.
No.
She can go back to doing her regular activities. She can wear makeup if she'd like to today. Very little discomfort. What we do recommend patients to do, though, is we recommend a series of treatments so that 3 to 5 treatments, depending on the patient's goals, are usually recommended, spaced out between every 4 to 6 weeks. Thereafter, we recommend a maintenance treatment of once every 5 to 6 months. Just to, as we age, our skin naturally will sag, but we'd like to continue to do maintenance treatments. We also recommend that the patients apply a sunscreen the day of, and we're going to give her a little bit, just because we've exposed her skin to different technologies.
15 or greater?
So we're using today SPF 50, anything over 30.
Okay.
So we'd like to just work it in into her face here. And this is the Vitale MD Medical Aesthetics sunscreen that we use, which has a little bit of green tea in there, so cooling, and it also gives you a little bit of a matte coloration, so it's almost like a foundation. So patients really like that. They don't have to put makeup on after this. They can just put sunscreen on, and it acts like a foundation. It moisturizes, and we always recommend patients to use sunscreen after laser treatments such as this. So the treatment does continue to work even after she leaves here today, and for the next several days. The collagen has been stimulated and new collagen will form, and as the days go on she will feel a difference in tightening underneath her skin, as we said, that we do recommend a series of treatments ongoing so that we can potentiate the effects that you received today. So thank you again, Jeanie, for coming in today.
Thank you. It was a great experience. I hope it works.
Oh, definitely. You'll love the results, trust me.